So you broke your elbow, but you notice that your fingers are so swollen and those seem to be causing more problems than your actual injured elbow. Hi guys, I'm Michelle from Virtual Hand Care, and in this video, I'm going to discuss why you might notice your finger swelling after an elbow injury and also what you can do about it. This was a recent question I received from a subscriber. This is often a common concern of many of you, and so I thought I would go ahead and do a video about it. So the first reason is going to be gravity. Gravity is going to cause all that swelling that happened at the elbow. It's going to travel down to the fingers because there's really nowhere else for it to go. Unless you're walking around with your arm up like this all the time, which typically that's not too comfortable in the very beginning stages of an injury, and you have to eventually put that arm down. So it's still gonna wanna go downward, and it really has nowhere else to go other than your fingers, and stay there. It's no different than injuring your knee and having your foot swell. Reason number two why your fingers are swelling after your elbow injury is because you're not using your fingers normally. They're not getting active movement. You're probably not, picking up items that you might normally do. Your activity level has probably decreased significantly. And so you're not getting any kind of active pumping of the muscles in the fingers and in the wrist, probably in the elbow and the shoulder. The whole arm is out of commission. Really what happens is there's no way for your lymphatic system to help pump that fluid out if you're not getting some kind of active movement or active exercise, or using your hand normally. And then the third reason typically why your fingers will swell is because you are wearing some kind of a cast, a brace, maybe a wrap. If you had surgery, you have a post-operative wrap on your elbow. Now, typically your fingers are free. Well, that swelling will find a path of least resistance. So just like with gravity, how it wants to travel down, if you have something compressing on your elbow, on your forearm, but not compressing on your fingers, that fluid is gonna find its way to an area where it can just go to. And so that swelling has found a path of least resistance, and unfortunately, it's your fingers. So now let's talk about what you can do and how you can help that swelling. Now, before we dive into those tips, go ahead and hit that subscribe button, and also leave a comment below if you have any questions or concerns or future video topics you want to see, and I will do my best to help. First, what you can do is elevate this arm. You can't defy gravity, but you can at least try to lift your arm up as many times a day as possible to try to help gravity then try to move that fluid down out of the fingers, a little bit more into the forearm, and then eventually, if you do that many, many times, hopefully you get it down going into a little bit more of the shoulder. Now, if your shoulder is bothering you, your elbow is bothering you, there are many ways that you can elevate. You can elevate by just actively lifting your arm up and just staying like that for a few seconds and then bringing the arm back down. So you can do an active elevation many times. For some of you, you might be so sore that you can't do that a lot. So then you can also use your other hand and you then lift that arm up as much as you can by using your other hand, or perhaps somebody else gently assisting you. Another way that you can help with elevation is propping your elbow up on a pillow, up on a table. If you're resting in a chair, put a pillow, a couple of pillows up underneath your arm so that it can be elevated if you are watching TV or on your phone or something like that. You definitely want to use those opportunities that you're resting to have your arm elevated. You can also lie on your back several times a day to let gravity help drain the fluid back down into your arm. And then the second thing you can do to help with swelling in your fingers is to do a light, gentle massage. And so I would recommend to do that while you're actually elevating your arm if you can, and then use your other hand or have somebody assist you. And you're going to apply a gentle pressure to your fingers. And you're wanting want to just do one finger at a time, and you want to take it in small sections. If your fingers are very swollen, it's going to take you a while, but that's okay. That'll be a lot more effective than just trying to cram all that fluid down into the hand. Your lymphatic system just can't absorb all that fluid. So you want to just do it nice and slowly, starting with the tip of the finger, working down to the middle part of the finger, and then working down to the lower part of the finger. And depending on how high your cast is, you can also try to get in between the web spaces of the fingers as well. And of course, don't forget that thumb. If your wrist and more of your hand is free, by all means, try to massage down as far as you can go. Now, a third way that you can help with swelling in your fingers when you have an elbow injury is active exercise. So as I mentioned before, you're probably not using that arm, those fingers very much, if at all. And so then you're not getting that active movement, the active pumping of the muscles. So as I always tell my clients, as your activity level goes down, you're going to want to increase your exercises so at least you get some movement going in whatever available joints you can. That would mean pumping those fingers and the thumb and the shoulder, whatever is free and not in your cast. And in fact, your whole body sometimes can crave movement. So just getting up and getting a little bit of movement going of your whole body can help with pumping that fluid out of your extremities. I do have a video that I will link here where I show just some simple little exercises that you can do in an arm cast to your fingers and to your thumb. But what you can do is simply work on doing what's called a claw or a hook fist. And you want to make sure that the fingers and the thumb are going into a hook or a claw. And the reason why we would do a hook or a claw is because sometimes casts are made a little high and you might not be able to go down into making a full fist and going all the way up. If you are able to do that, then by all means, make sure you are opening and closing those fingers as much as you can, at least 10 to 20 repetitions several times a day. Now, if you can't do that, if you can't do a full fist because you're swollen or because your cast is too high, at least try to start with a light hook fist. And that's where just the two little joints of our fingers are flexing. And then also make sure that that thumb goes into that hook as well. And then you want to straighten up as much as you can go. And you're going to want to do about, again, 10 to 15 of those through that full range of motion as much as you can, within your comfort, of course. And you're going to want to do that several times a day as long as your activity level is low to help keep the fluid from accumulating in those fingers. And you're also going to want to make sure that you do move that shoulder too, because if your fluid starts coming down more into the arm, you're going to want to make sure that you're moving and pumping that shoulder. So for one, the shoulder doesn't get stiff and painful, but also to help keep that fluid moving farther throughout your arm. And so to do that, you can do just a few simple movements of moving the shoulder overhead or across your body. A fourth way to help with finger swelling is to apply an edema glove or some kind of compression wrap to your fingers. If you have a removable cast, a removable brace, or a splint of some kind, then wearing an edema glove can help provide compression to your fingers and hand, and you can usually wear that underneath your cast. If you don't have a removable splint or cast and your fingers are free, then you can often wrap the fingers with some kind of a compression like Coban, which can be very helpful for reducing the swelling in your fingers. Now that does take me to my fifth way to help with swelling, and that is to seek help from your doctor or from a therapist. So I really recommend you to contact your doctor and talk to them about how swollen your fingers are. Are they just a little swollen? That might be pretty normal for your injury. However, if they're excessively swollen and you can't move your fingers, then that can be a cause of concern and can eventually lead to severe stiffness and deformity of your fingers, perhaps more so than your elbow may be causing. So you definitely want to address that early, especially if your fingers are free. You might as well be working on those fingers, keeping them nice and mobile and loose while your elbow is healing. So definitely talk to your doctor or a certified hand therapist, because they could show you how to apply an edema glove. They could perhaps put a removable cast on you. They could also talk to you and show you how to massage and show you active exercises to do in your cast so you can help with that finger swelling while your elbow fracture is healing. Now, I hope you found this video helpful. If you did, please give it a like, and also don't forget to hit that subscribe button below. If your cast has come off and you are ready to start moving the elbow, the wrist, the hand, then check out these videos here. Thanks for watching.